Sunday afternoon. I'm Bill Guerin, the organizer of this rally. A couple of weeks ago, I saw they're doing one in Bozeman. I thought, we don't have anything from Missoula. I think I'll try this. I had no idea what I was doing. Anyway, but Bozeman, 2,000 feet higher elevation. This is cold. I went to grad school there. It's cold there. And they're doing it outside on the doorstep of the courthouse. And I thought, holy cow, people will kill me if I do it here. So we thought we'd do it inside, and there's a reason for that. Just to tell you who I'm in, I'm a guy on Medicare. I'm a retired fish and wildlife biologist. I'm nothing in particular, except I have a great health care concern, and I imagine most of you do too, which is why you're here. And I've got family members that depend on ACA. And I know a lot of people. We probably all have a story that we can tell and why this is important to us, including our own health care. Since I'm on Medicare, that does affect me directly as well. But I'm also on the Missoula Progressive Democrats. That means I'm a Bernie Sanders guy. I went to the Democratic National Convention. Say, yay, Bernie! But, Bernie didn't win the nomination, but you remember what Bernie said over and over and over again? People looking for the hero out there. Bernie Sanders, I love the guy. But he said, wait a minute. It's not about me. It's us. It's all the way down the level. To things like this. It's not just the big events. It's not some hero in Washington, D.C. that's going to carry our water and convince everyone in the world. It's us. I take that seriously. I think I'm one of the us, and we're one of the us. So thank you for coming, because the goal of this event today is to explain to the degree we can, to help everyone come to understanding what the repeal of the Affordable Care Act and what the proposed congressional cuts in health care and subsidies means to the average American. It's just not that group over there. When you look at it completely, it pretty well affects all of us. And you think, gosh, what do we do? Now, I don't know if you get the Sunday paper. And if you're like me, if you read the comics, I need something like this during the day. And the Pearls Before Swine is one of my favorites. You know, the pig and the goat. Well, today, the rat was putting up a sign because he wanted to let the whole world not be ruined anymore. He was doing some political statement. And goat says, in fact, I think the reason we have so many problems today is that people just don't participate in the system anymore. They let other people make the signs, they go to rallies, and they never make their voices heard. We're here to make our voices heard. That's the goal. So it's not that you say, wow, there's some interesting stuff I heard today, because we have an expectation that you'll do something. You have a program in front of you. You got it. Turn it over. You probably already have. See some contact information there. That contact information is for you to do something. If you notice, one message in the bottom, this is something that's kind of cool I just got the other day. At the very bottom of the back side of the page, it says how you can get the phone numbers of your federal and state legislators on your telephone by sending a message to that particular 520 area code, if you're seeing that. And in the message line, it's not a one you make a phone call and talk on. You send a text message. You put in your zip code, and it immediately comes back with the phone numbers for Senator Tester, Senator Gaines, Representative Zinke, the state legislators, both Senate and House. That's pretty cool. And we put that there for a reason, because we want you to do something about that. We're here for a reason. And that reason is right now is to help inform people on what the healthcare repeal would actually mean. And I selected several speakers that have expertise on whether Medicaid or Medicare or on organized labor, on the faith-based community, and for the state legislature. If you notice down there, 1, 2, 3, I'm the third speaker. I'm probably the least expert of anyone on this whole list. I couldn't find a Medicare expert, but hey, I'm on Medicare. And if you're on Medicare, I don't know how many are AARP members. Did you see the latest newsletter? Yes. The summary on health care? Well, I summarized that, and I thought that was great. So I called AARP and said, yeah, use this. They said, you bet. So you'll hear that. Anyway, what I would like to do now, though, is get the program going. I'd like to offer the first 5 minutes. We'll try to keep us to 5 minutes, more or less, so you don't sit here forever. to Sarah Howell from Montana Women Vote. I worked with Sarah when we did Medicaid expansion in the state. She had me down there at Montana Women Vote, calling people around the state and saying, hey, let's get behind this. And the end result, we got it passed, and 61,000 Montanans now benefit from Medicaid expansion. I've asked her to discuss or to share what her thoughts are on the Medicaid impacts of the ACA repeal. Sarah? Oh, I forgot. One announcement we have to make. Pete Calvin.
I'm not Sarah. This presentation is being recorded by Missoula Community Access Television as part of a media assistant grant donated to our organization by MCAT. For more information, visit mcat.org. Thank you.
Well, hi everyone. Thanks for coming out on a Sunday to talk about healthcare. I see a lot of familiar faces in the room from our Medicaid expansion days. And I'm going to talk a little bit about what we did with Medicaid expansion and what that means for the moment we're in now. But I want to take just 1 minute first to step back and think about the big picture. 5 years ago today, in January of 2012, the state of Montana had a 20% uninsured rate. That means 1 out of every 5 Montanans was uninsured. Today, we're closer to 7%. Yeah. And if you work on these issues for long enough, you get to realize that a 13% decrease in our uninsured rate in just 5 years is amazing. That's incredible progress. And well over half of that decrease actually came just in the last year, as over 61,000 Montanans enrolled in our newly expanded Medicaid program. Now, folks might remember that before we expanded Medicaid, we had a real issue wherein folks who made too much money to be eligible for our existing Medicaid program, but not enough money to be eligible for subsidies on the marketplace, had essentially no option for health coverage. And what those folks did, more often than not, is they went without. They waited until they were so sick or so injured that they had to go to the emergency room. They went without prescriptions. They went without preventative care like cancer screenings and trips to the dentist. And we were all worse off for it. Folks got sicker. They had worse health outcomes. People missed work or lost their jobs entirely. And our hospitals and critical access care facilities faced really, frankly, staggering amounts of what they called uncompensated care, which is care they provided to people who had no ability to pay. Some of that money got passed on to all of us in the form of increased insurance costs. Some of that money, the hospitals just ate and faced a lot of financial troubles for it. So over the past 5 years, and in particular the last year and a half, we've come a long way from the dark days of 2012. But if the ACA is repealed, we are going to turn around and shoot back into those dark days real fast. And the truth is that we're not just going to go back to 2012, we're going to go much further back. There's a federal study that says up to or more than 142,000 Montanans could lose coverage if we repeal the ACA. That includes those 61,000 people who have signed up for our expanded Medicaid program in the last year. It includes 23,000 Montanans who get subsidies for private insurance that they're buying on the exchange. It could include as many as 41,000 kids who are covered under Healthy Montana Kids. And probably 15 to 20,000 more Montanans who will lose their coverage because of the disruption in the individual marketplace when all of these subsidies go away and millions of health insurance plans are canceled. So we're looking at going from 7% uninsured way back to 20, 25, maybe 30% of Montanans being uninsured. So I'm going to take 1 minute to speak particularly about folks who are covered on Medicaid since we've expanded. You know, these folks are particularly vulnerable. These are mostly working folks, but of that 61,000, 2/3, 41,000, are people who make less than 50% of the federal poverty limit. That's $6,000 a year in income for an individual, or a little over $12,000 a year for a family of four. So you think about a family of four living on $12,000 a year, you think those folks can buy private health insurance when Medicaid goes away? They can't. 34,000 of those 60,000 Montanans are women looking to lose access to reproductive health care. 8,000 are American Indians, 9,500 are veterans, and 14,000 of those 61,000 are between the ages of 50 and 64 years old. So these are folks, these are our family, our friends, our neighbors, and they are particularly vulnerable. And of course, our general state healthcare economy and infrastructure is at risk. If we repealed the ACA in the first year that repeal went into effect, Montana would stand to lose $698 million in federal funds in the first year alone. And over the first decade, we're talking about literally billions of dollars. So those hospitals, and particularly the rural hospitals, the critical access hospitals, the hospitals that are the difference between being able to get care where you live or driving 200 miles if your kid falls out of the apple tree and breaks his arm or your dad has a heart attack, those are the hospitals that are first and foremost going to face financial troubles. And we were lucky in Montana that we didn't see hospitals closing before we expanded Medicaid. But you look around the country to states that haven't expanded, and one of the major things they're dealing with is hospitals closing their doors under the weight of uncompensated care. So what are we going to do? Well, you know, at Montana Women Vote, along with a lot of you in the room, we spent 3 years working to expand Medicaid. And when we first started, we knew it was an uphill battle. The deck was stacked against us. We had a lot of people from around the country telling us that we couldn't do that. We weren't going to be able to get it done. But we did everything that we could because we knew that doing nothing was not an option. So this situation that we're in right now, it feels pretty dire. It feels like the ball is rolling downhill really fast. But we've seen this before. We've been in this position before. And so today, what we're wanting to call on everybody to do is do everything you can for as long as you can, because doing nothing is not an option. And I'll say that one of the lessons we learned when we expanded Medicaid here in Montana is that the voices of everyday Montanans were the difference between getting that done and not getting it done. It wasn't lobbyists, it wasn't the great folks from the Hospital Association, it wasn't people from organizations like me, it was real Montanans who picked up the phone every day and called their legislators and called the governor and said, this is what we need. And that was really the difference. And I think that we're already starting to see fraying around the edges of the momentum at the federal level due to the voices of people saying, we can't repeal, we certainly can't repeal without a replacement, there's gotta be a plan. So that's our charge today, to keep that up. Bill's gonna talk more about how we can do that. And the last thing I'll say is that personal stories are particularly important, and I suspect that everybody in this room has a story about healthcare and what access to healthcare means for ourselves and our families. Both Senator Tester and Senator Daines have on their websites a place where you can share your personal story. If you go to Montana Women Vote on Facebook, we also have a link where you can share your story, and if you share your story with us, we'll give you a call and make sure that you have every chance to tell that story that you could possibly want. And the more stories we get out there, the more people understand what it means when people have access to healthcare and when people lose access to healthcare, the better off we are in this push to hold on to what we have. Thank you very much.
Next we'll hear from State Representative Shane Morgo. Shane?
Fortunately, I'm about the same height as Sarah, so I don't have to adjust the mic a whole lot. Good afternoon, everyone. My name is Shane Morjo. I'm the proud representative of House District 95. That's here in Missoula, and I'm also a proud member of the Salish and Kootenai tribes. I wanted to thank Mr. Gear for inviting me to speak today, and thank all of you for coming out to share your concerns. I have received emails from folks as a legislator already, and I encourage all of you to continue to do that as well. I think it's important that all of you are out here to show your concerns and support for the 150,000 Montanans who are at risk of losing their health care coverage. You just heard comments from Ms. Howell about the harsh impacts of what ACA repeal would do, and more than 60,000 Montanans are at risk of losing Medicaid coverage. Additionally, one statistic that often you probably haven't heard much about is young adults between the age of 19 and 34. Around 30,000 individuals are covered currently. As Ms. Howell also mentioned, about 8,000, just over 8,000 American Indians are also covered currently under Medicaid. It's my view that healthcare should be a right. Not a privilege. We are obviously the richest nation on the planet. We have the capability to cover people, and we have the services to do it. Yet we allow big pharma and private health insurance companies to get richer and richer. The congressional majority chooses, in my opinion, they choose greed over life, liberty, and happiness. And that's why I appreciate all of you so much. It's promising to see that there are so many people out there that are selfless and steadfast in your efforts to help one another. Unfortunately, the blind and reckless approach that Congress is now pursuing threatens thousands of young adults, many of whom are just starting out with jobs that provide zero benefits. Because of the ACA, these young adults are able to stay on their parents' coverage plans until the age of 26. Repeal would leave them without any health coverage at all. In 2015, I had the opportunity to work on the HELP Act, and I got the opportunity to listen to a gentleman, I believe he was from the Bitterroot, and he talked about how he had a job, a good paying job for pretty much all of his career. And he was a single father raising two young girls. One was in high school, and the other one was on her way to transition into high school. I believe he said that his job was installing fireplaces, and that was his career for a very long time. And after taking a visit to the doctor, he realized that he had a health problem or a heart problem, and basically could no longer work in that job profession, or else it would possibly lead to death. So he looked around, he did odd jobs, and he finally found a job as a pizza delivery guy. And so this was something that he could do without putting the strain and pressure on his body, and actually make some money. Unfortunately, he made just a smidge too much to actually qualify for Medicaid. He didn't make enough to cover his family with health insurance. So without Medicaid or the HELP Act, he would basically his choice was no health coverage. I mean, his only choice was basically death. I mean, it was inevitable if he didn't get the heart transplant. That was going to be the result. Unfortunately, we passed the HELP Act in 2015, and he was able to get health coverage. So there's hundreds of stories like that in Montana, parents who need coverage for themselves and their families. And so what will happen if they go through with the current plan to repeal? People will die. Families will spend their life savings to help loved ones without insurance. More people get diseases that could be prevented from preventative health care or detected earlier. Hospitals and rural clinics will have to treat more people who can't pay. I think we saw that Vice President Biden recently talked about the fact that he almost had to sell his house. This is the Vice President of the United States of America who was on the verge of having to sell his house and car to help pay for his son's health care coverage. So the impact in Missoula is there's roughly 7,400 people in Missoula County that are currently covered under Medicaid. It'll affect all of their families and their friends. I know that there's many people who will have to take in family members to take care of them. The ripple effects of this will be felt everywhere throughout Montana. It'll be felt on every county, every reservation. In 2015, we knew that 1/3 of the 70,000 Montanans that were eligible for Medicaid were American Indians. And as mentioned several times, now over 8,000 American Indians signed up as of November 2016. Still waiting for the current, most recent updated data on that. Medicaid assists American Indians with coverage that isn't just life or limb, which is often the case with Indian Health Services, which I often call a ration system. Basically, get in line and get your rations. We know that Caucasian men in Montana live 19 years longer than American Indian men. We know that Caucasian women live 20 years longer than American Indian women. Medicaid is helping close that massive disparity. It's closing that gap. 43% of all Montanans, American Indian population, also live in urban areas, such as myself. House District 95 includes a minority population of about 14%, and roughly 8% of those individuals are American Indian. Because these individuals live off the reservation, they don't have the opportunity to utilize IHS delivery area. They're not within the delivery area. And without this coverage continuing on, those populations will suffer greatly as well. Congressional repeal of the ACA also puts the Indian Healthcare Improvement Act at risk. Provisions were included in the Affordable Care Act in 2010. The ACA permanently reauthorizes the Indian Healthcare Improvement Act, which funds IHS through direct appropriations and provides to streamline government efficiency by allowing IHS to collect from other entities. I personally don't think we can settle for this the reckless efforts of Congress to cut and run, to cut the benefits of working Americans and run away without offering any realistic alternatives. Congress do not have to worry about getting coverage because they have coverage. That's why all of us, we need to continue to reach out to our elected officials and share our concerns. And lastly, I just wanted to mention that there is a bill being sponsored by a representative out of Bozeman, Montana. It's LC 1216 is currently the draft number, and that's Representative Tom Woods. This bill would actually treat hospitals as public utilities, which would control the price gouging that Montanans, all of us, experience. So I urge you to research that bill and look into it, and thank you very much.
Thank you, Shane. And I'm probably the least expert here, but to summarize, I'll make it as quick as I can. I should have run a tally on all the numbers of millions of people we just listed, but those of us on Medicare, it turns out we have it pretty good. That's a wonderful program. If I had my druthers, it would be Medicare for all. How good is it? You realize there's 58 million of us on Medicare. And once you get to the vaulted age of 65, and I'm quite a ways past that, you say, wow, we finally made it where I can have affordable health care that provides, if you pay a little more, you can get a supplement, you can buy a policy where there's no deductible, and there's no copay, you can go to the hospital and not be bankrupted at the end. You know, I want that same kind of health care for everyone in this country. That's my personal view. As far as the 58 million of us that are currently on that, here's a nice statistic I just saw in the AARP article. 77% of people say Medicare is a very important program. And these are the same people that might complain about government inefficiency or something in some other manner, but not when it comes to Medicare, and not when it comes to Social Security, which is even a higher approval rating. Both my wife and I, she's a retired nurse, we're both on Medicare, we both had surgery, and we still have the savings account left afterwards. And I'm noting that when President-elect Donald Trump was a candidate, he repeatedly vowed to protect Social Security and Medicare, saying that the proposed cuts are not fair to the people who have been paying them for years. I know I paid Social Security for 53 years before I retired, and I paid Medicare for 49 years. Yet within days of his election, literally within days, the guaranteed health coverage provided by Medicare was cast in doubt. Congress is already moving, and you've seen it in the news, both in the House and the Senate, to repeal the Affordable Care Act and to erase the consumer-friendly Medicare benefits that the Act created. Yes, those of us on Medicare are fortunate, but we also get our ox gored on this one. These are the kind of additional benefits that the Affordable Care Act put into the Medicare system. One thing, remember the donut hole on prescription coverage? It closed the gap. Rather than spending many thousands of dollars out of our pocket, perhaps more than as much as we make in Social Security, it largely closed that door so it's much more affordable. That would disappear. The Affordable Care Act also added free preventative benefits and cut excess provider payments and improved the financial stability of the system. One of those preventative benefits, you may be aware, is like they pay for me to go to the gym, to exercise, to reduce the need to treat me in the hospital. And I was there before I came here today. And my wife makes sure, she's a retired nurse, she makes sure I'm there every day. And also, here's one I didn't know about till this week, that home health care for elderly veterans, this is beyond the VA system, is one of the Medicare benefits that will be eliminated if the act is repealed. It also took some steps to improve care coordination and reduce hospital readmissions. And insurance, if the act is repealed, would be allowed to charge older Montanans like us many times more than premiums than younger Montanans. And there's probably more than that if you sneak through however many words are in that bill, but it affects us all. This isn't that group over there. This is us in this room and people that we know and care about. So we have to think about that. The next person we have now to represent labor is Mark Anderson, for the Federal Labor Department.
Thank you very much. I wanted to tell a hopeful story because there's a lot of grim news. And part of that story is started in about 2006. And there are two gentlemen here that I want to have stand up. David New and David Brothers sitting next to each other. You guys stand up. These guys started in with the Carpenters Union back in 2005, 2006. They worked and founded this campaign called the Got It Campaign, which was, and I thank you guys, right? You guys need to, back that long ago, a lot of unions were looking when they go to negotiate a new contract, all of their wage increases that the employer had was going into health care. And these two gentlemen and others asked the question, well, why is that? What's going on here? We're not seeing any wage increases, it's all going into health care. And part of that ended up being, well, 2/3 of the increase in health insurance rates happened to cover the uninsured, okay? And that was the key thing that we figured out here locally. We expanded their Got It campaign, and the Missoula Area Central Labor Council, which I'm president now still, we took on a campaign knowing that Senator Baucus was going to be the head of the Senate Finance Committee, which was going to hear something about healthcare reform. Some of us had been involved when President Bill Clinton was elected. And he was elected, if you recall, largely on the basis of trying to fix healthcare insurance, okay? But they made three critical mistakes, which we weren't going to try to repeat this time around in 2006 and 2007. So one of the big mistakes was that I think the administration felt like they could just ram this through Congress without the help of the grassroots, of the American people. That the election was just enough, okay? And of course, as you all recall, the whole healthcare reform that they were proposing, and they had a ready-made policy package, which actually probably was a mistake too, it got killed. The insurance company rose up and ran ads and mobilized the American people against the act, and it all fell apart, okay? So this time we thought, we're gonna do better. We're not gonna make the same mistakes. And so we did a grassroots effort. We worked for years here in Missoula and Montana, knowing that we had an outsized influence on Senator Baucus. And so we worked really, really hard and tried at the Western Montana Fair and at the homecoming parade and all sorts of events. And pretty soon we found out that there were other people doing the exact same thing everywhere around the country. And in fact, at one point, all of these local efforts came together in what was known as Healthcare for America Now. HCAN is what we would always call it, this coalition. And it was that coalition that carried through. It had been, health insurance reform had been attempted for 70 years before that without any success. I mean, Medicaid and Medicare was a huge success in the 1960s. And it was opposed by the right wing and by the neoliberal folks as much as the ACA, if not more. We were able to get that, even that, we knew that the ACA was not enough at that time. We knew it was just a step along the way, but we needed to have something from which we could build off of. Okay, so the ACA, tens of millions of people now have insurance thanks to the ACA nationwide. All right, and it's at this threat right now that we're seeing. Okay, that is, we're in a much better place right now to fight against these cuts. We need to be pushing for more steps, right? We need to be pushing past the ACA, which was always meant to be. And that barely passed too, by the way, okay? So my basic point is to say that this time around, with something that we have, many things, good things we have to defend, Medicaid, Medicare, the ACA, some state programs here, all of that is under threat. But we know how to do this, right? Collectively, we know how to do this. And we know that we can step forward and we start working with other people and we build our solidarity with everyone, whoever is in need of insurance, okay? I'm not on the ACA insurance, okay? But I know, like the Got It campaign said, the slogan was, if you don't really have secure health insurance unless everybody has it, okay? And that fundamental truth, I think, can motivate us and know that we've been able to change things before, and this time we can actually not only, and it may be a rocky road, but I think we could even go beyond what we've gotten right now. So thank you very much.
Thank you, Mark. My name is Denver Henderson. I'm the organizer with SEIU 775. We're a home health care union here in Montana and Washington. We have worked for a long time with our brothers and sisters in labor and our coalition partners like Montana Women Vote and Planned Parenthood to lead a way for a more just and equitable society, and we're not going to stop now, right? So for all the reasons that folks have already mentioned, we're not taking this lying down. We fought to elect Barack Obama, we fought to pass the Affordable Care Act, we fought to pass Medicaid expansion, and we're going to fight like hell against this repeal. In order to do that, I need everyone's help. We all have to get involved. We have to roll up our sleeves and make that difference, whether it's writing a letter or making a phone call or come to a rally. We have the power if we choose to use it. I'm going to ask you to take that step right now. Because on January 24th, we have a National Day of Action where we are committed as a union and as a movement to generate 10,000 calls to the Congressional Switchboard to shut it down, to send a message that America is not taking this lying down. So if you can take 2 minutes out of your time on January 24th to make that phone call, we need your help. I am passing around this sign-up sheet. Please put down your contact information. We'll get in touch with you, let you know the details, but we need your help to fight back against this attack. Thank you.
I'd like to introduce Reverend Amy Carter from the University Congregational Church.
So I'm recovering a little bit from a bout of the stomach flu, so it was kind of interesting to have the stomach flu and be thinking about what one could say about affordable health care. My name is Amy Carter. I am the interim minister at University Congregational Church. We are part of the United Church of Christ, which is a Protestant denomination that's been part of the history of the United States since 1620, when the Pilgrims first landed on Plymouth Rock. I have been thinking this week that Christians just celebrated Christmas, which is the time when we talk about how God came to us in human form as a most vulnerable baby born in a stable under a brutal dictator. What does this mean, the incarnation? That means that God came to us in the flesh, and God knows us in the flesh, and that our body and our health matters. I'm also thinking about how the Apostle Paul talked about the body as God's temple, something that needs to be cared for, and that when we don't care for each other's bodies, somehow we are destroying God's temple. We are right now in the church in the season of Epiphany, which is a time when we talk about how the light of Christ is shining in the world and how we begin to explore what Jesus did in the world. And Jesus came into this world, and we read these stories of how he healed people who were sick, and he was in service with care and compassion and hospitality. And so the ministry of the church arises out of those stories, out of this faith that we have in God, who calls the world into being, creates human beings in the divine image, and intends for us the blessing of wholeness and harmony with God, with creation, with other persons, and even within ourselves. The Hebrew word shalom is often said, it's a reflection of this sense of wholeness. Sometimes we translate shalom to mean peace, but really the word is much larger and expansive than that. Shalom means wholeness in health. Shalom can mean wholeness in relationship to each other. Shalom can mean wholeness in relationship to ourselves individually, but also as a nation. So in the Christian community, and I would assume that in other faith-based communities too, we see healthcare in 4 ways: inclusive, affordable, accessible, and accountable. Healthcare is inclusive because it's a shared responsibility that's grounded in our common humanity. In the bonds of our human family, we are created to be equal. We are guided by a divine will to treat each person with dignity and to live together as an inclusive community. Affirming our commitment to the common good, we acknowledge our enduring responsibility to care for one another. And so therefore, we are called to act with compassion by sharing our abundant healthcare resources with everyone. Healthcare also must be affordable. Healthcare must contribute to the common good by being affordable for individuals, families, and societies as a whole. There is a sacred act of creation that we are endowed with talents, wisdom, and abundant resources necessary to meet the needs of one another, including the healthcare needs of all. Therefore, in our calling to be faithful stewards, we understand our responsibility to use our healthcare resources effectively and to distribute them with equity. Healthcare should be accessible, too, to all persons. We believe humanity is sacred and that all persons should benefit from those actions which contribute to our health and our wholeness. Therefore, we are called to act with justice and love and to ensure that all have access to health care. And we need to live out so that we can all live out the fullness of our potential, both as individuals and as members of our society. And that we believe that healthcare should be accountable. The healthcare system must be accountable, offering a quality, equitable, and sustainable means of keeping us healthy as individuals and as a community. We believe that as spiritual and sacred vessels, we are responsible for the care of our bodies to the best of our ability and for the care of one another regardless of individual circumstances. Therefore, individual families, governments, businesses, and the faith community are all called to work in partnership for a system that ensures fully informed, timely, quality, and safe care that treats the body and the spirit. The scriptures of the Abrahamic traditions of Christians, Jews, and Muslims, in addition to the sacred teachings of other faiths, understand that addressing the general welfare of the nation includes giving particular attention to the poor and the sick. A hasty decision to repeal the ACA before any replacement plan would set our country back and would also cause untold suffering, disruption, and anxiety in the lives of millions of Americans who have gained coverage through the ACA. This is bad for their health and bad for the health of our nation. So I encourage you to call your senators and to speak up to change this situation. Thank you.
Senator Diane Sand, senior state legislator from Missoula County. I recall before she turned out the House, she served in the South Health Care Committee.
Thanks, Bill. I'm glad to be here today. Yes, I have served on the Healthcare Committee for all of my 4 terms in the House and currently in the Senate as well. In fact, I chaired the interim committee on healthcare back when the ACA was under consideration and we were required to study it, and actually have read all 1,400 pages, put little tabs, etc. on it numerous times. I figured someone should say they have actually read the darn thing. And I also have worked as a healthcare advocate in Missoula in various capacities, everything from being on the board of Planned Parenthood and Blue Mountain Women's Clinic, but I also did some work for the Missoula Indian Center and am one of the founders of the Missoula Partnership Health Center. And they are all included in the ACA. Should it go away, things such as funding for our community health centers that fund and serve over 100,000 people in this state will be gone. So we don't know how quickly this will happen, for sure. And as a legislature, we're looking at how that will come out. Those of you who are focused on the feds, I'd urge you to stay in touch with the legislature, go to the pull down on legislative bills, look at what's coming out in terms of health care, because what we do in the state relative to health care is impacted by the federal, and there will be, I think, a number of bills, referendum, things of that sort that the Republican majority try to support repeal of the ACA. So please stay in touch with us. And I'm here today to read Senator John Tester's letter. The handout you've got from John's office has contact information on it and lots of great statistics and information that you'll need for writing your letter to the editor or your letter to the congressional delegation or your Missoula delegation. Here's Senator Tester's letter. I want to thank everyone for showing up today and making your voice heard for this critical debate. The ACA has made a profound difference in the lives of thousands of Montanans. Today, more Montanans have health insurance than ever before. Folks are no longer denied coverage by insurance companies because of pre-existing conditions like diabetes, or forced to pay higher premiums for common ailments like high blood pressure. Children are able to stay on their parents' health insurance until they finish college and launch their careers. Folks who have threatening diseases like cancer can finish their treatment without hitting an arbitrary lifetime cap and being kicked off their plan or ending up in bankruptcy. And seniors can get out of the prescription donut hole faster, which was costing them millions of dollars every year. In fact, the ACA was signed into law. Montana seniors have saved $56 million in prescription drug costs, and there's enough money in the bank to keep Medicare above water until the year 2028. These reforms have made an incredible impact on folks and communities across Montana. They're real success stories with real-life impacts across Montana and across the country. But rather than build on these successes and fix the problems of the ACA, there are folks in Congress who want a full-scale repeal of the progress we have made. These folks are currently pushing repeal without any plan for replacement. That's because they have no plan to cover the thousands of Montanans who have access to health care because of the Affordable Care Act. And if they do have a plan, they need to show it and prove to folks across the country that there's no funny business going on behind closed doors. What they will actually do is take us back to the old healthcare system, and here's what it's going to look like for Montana. 152,000 Montanans with pre-existing conditions will be at risk of losing their health insurance. 61,000 Montanans enrolled in Medicaid will lose health care coverage. Montana seniors will lose help paying for prescription drugs. Insurers will be allowed to subject every Montanan to lifetime and annual caps on their coverage. And women will lose more important protections that prevent them from being charged more for coverage than men. The plan to repeal the ACA without replacement cuts even deeper because it puts rural hospitals and clinics at risk and eliminates the ability for medical providers to innovate. That's why we need to fight back. Call the other members of the congressional delegation, call John as well, and tell them how the Affordable Care Act has helped you and your family. Tell them they need to vote, that a vote to repeal the Affordable Care Act is a vote to take us back to the old healthcare system that didn't meet our needs. And if that didn't work, tell them their plan to repeal the ACA will add an additional $350 billion to the national debt. $350 billion to the national debt. Also talk to your neighbors and write letters to the editor. This fight is far from over, so please keep up the great work. Senator John Tester. Thanks.
And now it's my pleasure to introduce a couple who hasn't heard of Rob Quest.
Well, thank you very much. It's a great honor for me to be here today to speak to you all about healthcare and to relate a personal story that I have personally faced. You know, as we all know that, excuse me for, you can hear I've got a little bit of a cold, you know, which it's amazing we're talking about healthcare when we're all dealing with these health issues, right? But, you know, as, you know, of course, the way that healthcare was originally meant to be was a self-payer system, you know, but of course that was blocked by those special interest groups that Shane was speaking about just a few minutes ago. And of course now they want to take us back to the system that did not work at all. And you know, as you know, many of our friends and neighbors are forced to have GoFundMe sites, and I played many benefits for people who have not had the health care that they need, you know, to cover just large expenses. And so, you know, the way that it was designed, you know, with Medicare, you walk in, you show your card, no questions asked, and you're covered. And that's the way it should be for everybody in my mind. And in our own Flathead Valley, we have a doctor that is a naturopath, and she has been selected as the outstanding doctor in the Flathead Valley for the last 6 years running. And of course, she is not covered by any medical plan. You know, and she gets her patients off pharmaceuticals. They wanted to put me on, I had a low thyroid issue, and they wanted to put me on this medicine called levothyroxine. Well, of course, I went to the internet and I decided to you know, just see what kind of side effects. And the list was just staggering. It was there was congestive heart failure. And you know that you've heard these things, you see them on television every night where, first of all, they list some little medicine for curing the common cold, and then it has all these heinous things that are way worse than the malady you're trying to cure. So, and then of course the ads after that is, if you've taken whatever, Ziclavar or whatever it is, then you should call this lawyer system, and I mean, what kind of system is that? It's just, you get caught in that, and it's a never-ending cycle down. But to give my personal story, I went in for just a gallbladder surgery many years ago, and it was a typical thing where I think the doctor was scheduling twice as many surgeries as he should have, and he was really hurrying, trying to get through, and he suffered my common bile duct by mistake. And so this sent me into a 5-year tailspin, and so I went through all kinds of surgeries, to try to rectify this. I went over to Seattle and to Swedish Hospital, and my wife found the best guy in the country. He was just a great doctor, and he saved my life. And so I wouldn't be standing here today without having that benefit. But of course, through all that thing, then of course I was thrown into the pre-existing conditions mode, right? That many of you have landed in. And so then when I had back surgery some years later, then I didn't have insurance to cover that. And so I was forced to go on Social Security at that time, much earlier than I wanted to. I wanted to wait until the full cycle so I would get the full benefits, but I was forced to get on Social Security much earlier than I wanted to. And so, as you may or may not know, well, first of all, I just want to say that, Montanans, we just live in this land of untold beauty, and, but it can be an unforgiving land for those who aren't hardy and resourceful. We've learned how to be resourceful as Montanans. But, we have, of course, our proud Indian tribes that have been here for thousands of years. And we have immigrants from all over the world. But we've learned that we have a strength in unity. And we know that if we stand together as neighbors, when we rely on each other, then we go forward. And we also know that when we have differences in opinion, we sit down and we work our differences out with respect, which is sadly lacking in these days. So I've decided to throw to quote James Conner at the Flathead Drum, my well-traveled cowboy hat into the ring to be your next congressman for the state of Montana. And, as you know, this is not an easy thing for me to put down my life of music, which I dearly love. But I think that now is the time when we all need to stand and make our voices heard. And as you know, the pendulum will swing one way and it'll swing the other. It's a cycle that Montanans all face. But I want to be a part of the movement, to bring us back into the light. And so I'm willing to make this sacrifice. And so, and of course, songwriters, as we do, we always write what's on our heart. We always, and so that's part of my therapy and who I am. And I don't think I'll ever, even though if this happens and I go all the way to the halls of Congress, this will be something that I will always do for myself. I just probably won't be performing. But I did write one song I'd like to share with you. And this is the last song I've written. And the idea of the song is that we need to stand up for each other. That's what we do as Montanans. And I know people are hurting. This world can be so cruel. And ugly rumors raging around you. Sometimes you feel just like a fool. But if you stand with me, then I will stand up for you. You are not alone, I want you to know. This world wouldn't be the same without you. And we can never be truly free until we lift all humanity. Don't ever let it get you down when trouble comes around. If you stand with me, then I will stand up for you. And I'll be a strong shoulder to lean on when life seems cold and In every way I will defend you. Count on me to be there. And you can stand with me, and I will stand up for you. You are not alone, I want you to know. This world wouldn't be the same without you. And we can never be truly free until we lift all humanity. Don't ever let it get you down when trouble comes around. If you stand with me, then I will stand up for you. Stand with me, and I will stand up for you. Thank you.
This would be a good time, if anyone has any questions for any of the speakers, this would be a good time to ask it. If you don't have questions and you want to leave, just remember your responsibility as part of the us. Make your calls. In the rear, can you, I struggle with hearing a little bit, can you come up here, please?
Hi, my name is Sean, and I have a question for Deb. She's still here. Just curious about the reason why Senator Tester just voted down the amendment to bring in Canadian imports. Just curious about that. I was wondering if you could speak to that, maybe give us some insight on that, and also some idea of maybe things we could say to John in regards to that.
I read the response the senator gave, and as I recall, it was, well, he was concerned about the safety of drugs that would arise in Canada. Others raised the doubts that those drugs are well tested and they're keeping Canadians alive. But now remember, you're making the calls. You can ask Senator Tester, why did you do that? That is our responsibility as voters to say, you know, that's not one we can agree on. And I would urge you, you know, look at, we want health insurance affordable, inclusive for everybody, and part of that is prescription cost, and that was a mistake perhaps. If someone else has another answer, I'd like to know who it is. Are there any other questions? Ma'am, could you come up here, please? Well, Representative Morgo and Senator Sands, what is your recommendation? How often should we call our legislators? I've called them quite a bit. Yes.
I know you can leave, if you call, at least for representatives and senators, you can call and leave a message for 6 representatives at a time. But of course, you can go online and email, and I think you can message people as much as you want every single day if you have the time, of course. So, I would encourage you to reach out to, if you can, at least every single one in the legislature, even if it's someone you think is a friendly to this issue.
I agree with that, but just remember those of us who are in the House and Senate don't have staff, so we'll get back to you as best we can. But congressmen and Senator Daines have staff, so go ahead and call them every day.
I would just add, Senators Daines and Tester have multiple offices in Montana as well as their offices in DC. What I like to do is just call a different office every day, and you can go through every week, you call each office once, and you get to talk to different people, you feel like you're not calling the same person every day, but you are making a phone call every day, spreads the joy around a little bit.
You know, I have a question of the audience here too, because I make my calls and, email's good. I'd rather call someone, but what even seems to be more effective when you show up in their office. So, I had them collect their name and their contact information, and one of the reasons is, I'd like to raise a hand, and maybe if you stay a couple minutes afterwards, I can identify you. I would like to compose formal letters of what our opposition is to the repeal of the ACA and what we recommend, and have a group of perhaps several of us take them to their offices here in Missoula. Who would be willing to do so? Would you folks, would you mind before you leave, gather right over here? Thank you.
It's also helpful for us, I know particularly in the legislature, you're just saying yes, vote, no, fine. It's not really helpful. It's more helpful if you write me a couple of sentences of why. I mean, so that I have something I can bring it up in the committee and say, I heard from 20 people and here's what somebody said. That kind of, give me your opinion, give me your experience on why you think a certain bill is a good idea or not. Put that experience in your email, your phone message, or write us a letter.
And that is very important to do, and calling and contacting your congressional representatives is important. If you're also looking for something a little bit more comprehensive or other ways of acting, next Friday, all day long, Missoula Area Central Labor Council is hosting Organizing for Power teach-in. And I don't know if Emily's still here, she's in the back. If you want more information about how to learn how to do more organizing, and this is not to take away from calling your representatives, but for doing larger actions perhaps, come to all or part of this teach-in on next Friday, Inauguration Day.
Yes.
I just want to say that the other night I got on Senator Daines' town hall telephone call. I have no idea how I got there, since we're sort of opposed to a lot of things that he's but I thought this time I'm going to stay with it till the end of this thing. So I think it took about half an hour, I don't know. He didn't get to me to ask a question. Because in a lot of these telephone things, I think they screen for friendlies. But at the end of it, they ask for a vote. How many people would have be in favor of repealing the Affordable Care Act? Well, actually, I got my vote in there for not repealing it. But there was only a handful of votes. So people either go home, quit listening, hang up the phone, but stick with it. If you happen to get on one of these things, it's worth doing.
Right.
And so I called Deb France and told her about this whole scheme that they have and how they do it. And one of the things that doesn't get mentioned enough is that in Daines' forum, people said, oh, our cost of Blue Cross Blue Shield went up, skyrocketed, $750 a month. So I said, well, that's weird, mine didn't. And I don't know why that is. But one of the things is that if you defer maintenance, in other words, it's like your car, you can let it go and let it go and let it go. And then boom, all of a sudden we got onto the Affordable Care Act, and people started getting the hips replaced, knees replaced, who knows what else replaced. And that probably did cause a rise in costs. But that, I would think, would be a temporary thing that you have to work out through the system. But that's all I had to say.
Before I head out, I just wanted to let you all know that I have a bill on Monday for House Bill 185, which would provide grants for students to attend community college, tribal colleges, and two-year institutions of the university system. So Encourage you to go look at it online. I'm actually going to go home and start working on it, well, complete working on it, I should say. Hopefully I complete it today. Been working on it for a couple weeks now. So anyways, thank you all. If you have any questions for me on this, feel free to reach out to me by email or call. So thanks.
At a meeting recently where Deb Franson talked about all kinds of political things with us. And one of the things that she said was that, as far as she can see, the very best way to get the federal people to pay attention to you is by showing up at the local office. Because she said it's one thing to send emails or phone the Washington DC office where they're getting billions, not billions, but lots and lots of those things. But if you keep on showing up at the local office, that local staffer begins to know you and begins to know what your issue is and begins to talk to Senator Daines or Senator Tester about it and say, yeah, that Linda Jillison, she's been in 5 times talking about the same thing, or she and her friends have been here 3 times talking about the same thing. So I think that was one thing that made good sense to me from what Deborah said, and I think we should all follow up on it. I think it's good that Bill's mentioned this possibility of showing up. Also, let me just say, this little thing that Bill gave you at the bottom, if you have a smartphone that has all of the phone numbers on it, that is dynamite. I mean, I don't like technology very much, but that's really helpful. And I've used it a lot since Bill gave it to me a week ago. So if you have a smartphone, too bad. But if you have a smartphone, put it on there because it really, you can just push this button and all of those phone numbers come up for you.
Those that raise their hand that they're willing to make a visit, come right over here. The only thing I want you to do is write your name down. Oh, there's a lady in the back. Oh, okay. And I'm just going to have you write your name down because I've already casted it in the clipboard and I will contact you. Yes, ma'am.
I wanted to say one other thing.
Yes, ma'am.
Related. Okay. I talked with Deb Franson last week, and I was asking what can we do to help John Tester because he is our strongest defense in Washington, D.C. And among the things she said is when you write a letter to John, make sure that Zinke and Daines also get the same letter so they can say, well, we haven't heard about that. So get in touch with them. And also, as these hearings come up, you might want to thank him for some of the difficult votes because it's not going to be a very fun time. And finally, if any of you are good at writing letters to the editor, those are still good things to do and a good use of your time. Thank you.
Yes, ma'am.
I just have one other comment, and that is, it's very good to focus in on the federal problems, but right now the state legislature is talking about confirming their idea about a $93 million cut to the Department of Public Health and Human Services. And that's twice of what the governor put in his budget. And half of that budget cut is to seniors and children at risk. And programs like Meals on Wheels, Meals to Senior Centers, hospice, personal assistance to low-income seniors that live on their own, and assistance to low-income seniors in nursing homes is going to be affected if this goes through. So you also have a need to try and rally for health care at the state level.
Let me respond to that a little bit. First of all, there's going to be a rally next Saturday in Helena, and we expect 3,000 women on these topics. But I'd like to introduce to those of you who don't know her, our new representative, Marilyn Ryan, who is serving. You know her from the Education Committee, but she is serving on the Appropriations Committee that makes these decisions. Marilyn?
Yeah, it was a pretty dismal week because the cuts that you were just mentioned, there were the governor's cuts, 5%, and then there were Republicans' cuts, and then there were some more vacancy savings. It's going to hit senior citizens, especially those in rest homes, dental care. It was a pretty dismal week. On the Health and Human Services Subcommittee of Appropriations, there are 5 Republicans and 2 Democrats. The vote for those bills to make the initial cuts, they're calling it a starting point, was 4-3. So one of the Republicans did vote with the two of us who are Democrats. We have a long way to go. They basically made all these cuts, and now they're waiting for the agencies and people like yourselves to let them know that we don't want these cuts. So it's vital that you keep contacting your state legislators about these issues, and particularly the Appropriations Committee. Yes?
I have a question then. What can we do to put in public comments that it seems like the legislature is trying to rush through on a 70-day completion, so that they have 20 days available next year if they have to meet, and the fact that that does not allow adequate public comment towards those cuts?
Like you just did. Because we're not taking care of our people's business when we're cutting our days short and anticipating what the feds are going to do. We don't know what's going to happen. We just have to keep working. But I certainly would agree. It's I'm new, so I don't know what to expect day after day. But it seems to me as a newbie that we didn't have a subcommittee meeting on Appropriations Friday. We're not working Saturdays for 6 weeks. It's a little disturbing, and people need to be aware of the cuts you're mentioning. So keep passing the words. Last week we got a lot of contacts about cutting dental insurance for Medicaid patients. So keep up the good work and communicate, communicate, communicate. Thanks.
All right, those who raise their hand, over here.
I did.
Just put your name.